Kenya is undergoing an epidemiological transition. That was a bit of a tricky one there, marked by a decline in morbidity and mortality due to communicable conditions and an increase in the burden of non-communicable diseases. These non-communicable diseases include illnesses such as diabetes, cancers, cardiovascular diseases, and chronic respiratory infections. The burden of NCDs and injuries has been constantly rising over the years, both globally and in Kenya, even though they are preventable. Rudin Almoge shines a spotlight on the situation in Wajir County, where more than 14,000 cases of hypertension and 8,000 cases of diabetes have been recorded in the last 6 years.
Mimi naitwa Mohamed Dagani Osman. Ni mzee ya Wajir, niko na mwaka 67. Karibu sasa miezi 6-7 najaribu kufanya morning run na warm up. Kwa shauri naona kwamba pengine nikikaa sana naweza kuwa mzito na pengine nipate ugonjwa wa kuumwa na mwili, sukari, pressure, mambo kama hivyo.
In the morning when I'm sitting around where we are now stationed, I see very many people either jogging, running, or walking along this road. And these are people I knew who are normal, who had no problem.
Cases of non-communicable diseases in Wajir County have been on the rise over the last 6 years as locals get more purchasing power. With more than 14,000 cases of hypertension and nearly 10,000 cases of diabetics, the county has kicked off a program to get the locals in shape to prevent non-communicable diseases. Besides encouraging locals to be physically active through running and walking, the county has more than 10 indoor sports arenas that appeal to the young people. Football is the activity that appeals more to the locals. For many of the young people here, there is no better way to exercise than play ball games.
Tangu nilianza hii mchezo wa 7-a-side, nimejaribu kwa mwepesi hata kwa hali ya kukimbia ama matembezi. Zamani nilikuwa kwa kilo kama tukisema nilikuwa na kama 75. Sasa hivi juzi nilijaribu kujipima, nikaona nilikuwa nimepunguza kama kilo kama 15 hivi.
There's something wrong with the eating behavior. It's like they needed this so much, and when they got the opportunity, they went in without control.
Evidence is emerging of a rise in non-communicable diseases and injuries related to rapid urbanization and adoption of lifestyle changes characterized by high caloric intake, excessive alcohol consumption, and physical inactivity. Cancers, cardiovascular diseases are increasingly focus of public health prevention efforts in Kenya.
Non-communicable diseases is now on the rise because most of us are not working out. Most of us are always in our cars, and we used to have a lot of malnutrition, but now also we are also developing on the other end of now obesity, which is also on the rise in our country.
Na sasa wakati ya devolution imekuja, watu wameanza kupata pesa na contracts. Sasa unaona, sasa watu wakipata pesa wanakula ovyo ovyo, wanasahau ya kwamba hii mwili nayo inataka kuchungwa, lazima itembee.
With worrying statistics, the conversation to battle the invisible enemy has started here in Wajir, as some make it a business venture.
Some of the kids in school, in primary school, are overweight. If you talk about 10 years, I believe we may have a calamity. A calamity.
We will definitely have a lot of diabetics, a lot of hypertensive, a lot of obese people, and the government will have to now ensure that as we work towards prevention, we also ensure that we have enough trained personnel in areas of non-communicable non-communicable diseases to ensure that those who develop the complications are treated, as we also encourage people towards prevention of the same.
Kenya has made progress in tackling various health challenges, particularly those linked to priority communicable diseases. And the National Long-Term Development Policy outlined in Kenya Vision 2030, the government has committed to making strategic investment in health service provisions to improve the quality of life of its population. Further commitments were made in the Kenya Health Policy 2014-2030, which aims to achieve universal health coverage by scaling up priority health services to populations in need. And in order to reduce the prevalence of non-communicable diseases, Kenyans have been urged to exercise for at least 30 minutes a day, as recommended by World Health Organization. Nuruddin Almoge, NTV,